Name is Irma, I-R-M-A, Cota, C-O-T-A.
And your title again?
President and CEO of North County Health Services.
Lisa Orman, Clinical Operations Manager for Mountain Health and Community Services.
And spell your name for me, please.
Lisa, L-I-S-A, and Orman's O-R-M-A-N.
Jack Clausen,
And would you spell Clausen for me?
K-L-A-U-S-E-N.
And your title?
I am the site director and head hospitalist for Vista Community Clinic's Women's Center and obstetrical panel.
I'm Barbara Menino, and I'm the CEO of Vista Community Clinic.
And please spell your name for me.
M-A-N-N-I-N-O, Barbara, B-A-R-B-A-R-A.
Tracy Ream, CEO for Neighborhood Healthcare.
And spell your name.
T-R-A-C-Y-R-E-A-M.
The immediate impact to the cuts in healthy families and Medi-Cal means that thousands of children will go without health care. Many of those children are children with chronic conditions that need to continue their health treatment and their medications.
The babies and young children will suffer from these cuts.
People will be harmed. More money will need to be spent to care for them. And all the things that we have set in place to keep down unwanted pregnancies, to keep down people that are ravaged by chronic diseases that should have been cared for earlier. If we let that happen, we're being foolish, and that is what it looks like is going to happen if his budget proposals go through.
Every month, the community health centers take hundreds, sometimes thousands of referrals out of the emergency room for people that are uninsured. And we're able to care for these people because we can take care of them in the clinics for a lower cost with the help of the funds that come from the state. If these dollars go away, we'll be hard-pressed to be able to handle the increased demand that we'll have because there will be more people going to the emergency room.
There's a real danger in all of this as we try to balance the budget, which we all know needs to happen, that some of the costs will actually get pushed further down the road, but it will end up being more costly for the state of California. All of the community health centers are experiencing spikes on individuals who had jobs, they suddenly lost them, they lost their health insurance. They are slowly finding out that community health centers are there for them. So in the short term, you're only going to worsen the situation that we see in the economy right now with the impact of unemployment and foreclosures. In the long term, we're going to see a very already sick population in many ways become sicker. And that's going to take its toll.
We are asking the governor not to balance the budget on the backs of our children of this state. In San Diego County alone, we anticipate that there are over 50,000 people in the North County, children who will be affected. These children will no longer have health care coverage. These are the children of people that are working poor people, people who do not have health insurance and who are holding down jobs. And the support that this program provides for their children is very important to the health of this community.
I understand that we need to bring the budget under control because the state has run out of money. But my appeal to the legislator and the governor is to find other resources to maintain coverage to the most vulnerable population of California. If we don't take care of this vulnerable population, the health care of the entire Californians will deteriorate, not just the children.
And the Healthy Families Program is federal dollars that is matched with state dollars. Those are dollars that are very important to the state of California, and they'll have to give those up. Those programs will go away while the economy is difficult, but there will be other needs down the road, and then we'll have to start those programs all over again.
So we're just not talking about the preventive care of immunization and well child care. we're talking about children with serious conditions who will be affected, and their families will be affected, and the entire healthcare system will be negatively affected by these cuts.
Our concern for the proposed budget cuts is that they have not looked at the true impact that will happen to the rural East County communities, including Alpine, Campo, and Jacumba, where we do have community health centers. These communities have no hospitals, pharmacy, or specialty care for the 950 square miles of Mountain Empire.
The short-term problems are that we will have to, as community health centers, dismantle an infrastructure that we've built of committed physicians, nurse practitioners who are seeing patients who really would otherwise be going without care or going into the emergency rooms.
The governor's proposal proposes to eliminate the State Office of AIDS. This will eliminate community-based programs that help with the prevention and spread of this disease. These programs target those populations that are at most risk for HIV and for AIDS. With the elimination of those funds, these programs will go away. This is a public health issue. It affects everyone, and it is very critical to keep those funds in place to make sure that we can control and one day eradicate this disease.
There we go. A little bit. Let's see tu boca. Oh, muy bien. Now saca la lengua. Ah, good. Muy bueno. Okay. Yeah, just picking you up. Okay. Ah, muy grande. That's it. Arriba. Okay, bigger. This is good boy.
Where when when we checked it initially, she wasn't fasting or anything. You put that in May 9th. Yeah.
Mira, la boca abierta. Otra vez. Otra vez.
How is Alan with this car? He's better. Okay.
5.6 kilos, and then this is his height. So this is how long it is.
A ver la naricita. Eso mero.
You have to go a little harder than that. That's 170. Great big. Oh, good one. Okay, so.
La vacuna.